Here's Rachel. We're going live. All right. Good afternoon, everyone. Welcome to the Member Cafe. We're going to give just a moment to let everyone get in. Our numbers are ticking up, so we'll just wait just a minute before I get started. All right, so good afternoon and welcome to Partners Health Management Member Cafe. We are so glad that you've been able to join us. So as we get started here, I'd like to share with you who has joined us. My name is Ann Gluff. I am part of the member engagement team here at Partners Health Management. I'm a supervisor. And also joining us is Beth Brooks, also a member engagement supervisor and technical wizard for this session. And then we have Melissa Hatton. Melissa, you want to give a wave? Melissa is one of our member engagement specialists who is always out in the community, answering questions on the phone, etc. She's here to support us as well today. And then Cindy Troba. Cindy Troba is our member engagement manager. She is joining us today as well. Carter Wade right there in the center. She's our guest speaker. I'm going to tell you more about her in just a minute. And then I have Rachel Jerzak. Rachel is the assistant director for IDD care management here at Partners, and she's joined us to help answer questions as they come in. So before I tell you more about our guest speaker, let me just go over a few housekeeping rules. Oh, and for those of you who are new to Partners Health Management, I want to let you know that we are a managed care organization for North Carolina Medicaid and state-funded behavioral health services, mental health, substance use disorder, intellectual and developmental disabilities, and traumatic brain injury. So at the end of our session, time permitting, I'm going to share some additional information about Partners and about the member engagement team. So housekeeping, want to let you know that this session is being recorded. So please try not to share any sensitive information during our session. If you would like to talk to Partner staff afterwards, we can make that connection and set up a time for us to talk. The recording and the PowerPoint slides will be available on our Partners website under member education, under the member education tab. Won't be available today, but soon in the near future. So as we are presenting, as our guest speaker is presenting specifically, if you have questions during the session, what I want you to do now is take a look at the bottom of your screen and you should see Q&A. And so that's where you want to answer your questions. So please do enter your questions as they come up. I know often you forget them by the time the presenter's done speaking. So as soon as the question comes up, pop it into the Q&A. And we're going to moderate those questions at the end of Carter's presentation. And we'll be able to address those questions at that time. And of course, at that time when we're doing questions, if you want to raise your hand, using the raise your hand option also at the bottom of your screen, you can do that as well when we get to the question and answer session. So without further ado, let me tell you a little bit about our guest speaker. So Carter Manning Wade is an outreach and education manager for the North Carolina Medicaid enrollment broker. She and our North Carolina Medicaid enrollment broker is Maximus. She joined them in 2018. She leads a team of over 40 outreach specialists. I'm gonna get my glasses. That thought just a minute. Leads a team of over 40 outreach specialists who are located across the state, providing outreach and education virtually and in person. So prior to joining Maximus, Carter was a business development manager for East Tennessee State University College of Nursing's 13 nurse-led sites in Northeast Tennessee that included federally qualified health centers FQHC. Some of you may have heard of an FQHC, and a rural health clinic. Her prior experience also includes the senior living industry marketing, nonprofit management, and software sales. She has a passion for serving and improving the health of underserved and underrepresented communities. So she's a native of Spartan, South Carolina, and lives in the Raleigh area. So welcome, Carter Wade. We are so glad that you're here with us to share information
Thank you.
about North Carolina Medicaid managed care. And I'll
My
let you take it
pleasure.
away.
My pleasure. I'm going to go ahead and share my screen just one moment. Let me get everything in the right place. So I got to move some things around. Okay. All right. What I usually see is not here. Just one moment. Apologize for the delay. I can flip it over. Just one more moment. Okay, display settings, here we go. All right. What are you seeing on your screen right now? NC Medicaid enrollment broker? Okay, great.
Got it.
Awesome. Thank you everyone for joining us today. Again, I'm Carter Wade, Outreach Education Manager with the North Carolina Enrollment Broker. I got one more thing on my screen I need to minimize. There we go. Okay. Now, please know the North Carolina Medicaid Enrollment Broker is here to answer questions you may have and assist you and your family through this transition. Now, have your pen and paper handy because there's going to be a lot of information. I want to make sure you can take notes and get contact information. Now, who or what is an enrollment broker? That may be a new word to a lot of people. The enrollment broker is an unbiased third-party entity partnering with the North Carolina Department of Health and Human Services, NCDHHS, to help beneficiaries transition from NC Medicaid Direct to NC Medicaid Managed Care. We are truly independent, and our goal is to help beneficiaries select the right health plan option and primary care provider based on their health needs and other factors that are important to them. An unbiased enrollment broker, and that's what we are, can ensure program integrity while helping beneficiaries select the best health plan coverage for them and their family. The goal of the enrollment broker is to simplify the enrollment process to make it easy for beneficiaries to understand. Now, NC Medicaid Managed Care has changed the way most people receive Medicaid services in North Carolina. 1.7 million Medicaid beneficiaries were enrolled in standard plans, or the EBCI tribal option that launched on July 1st, 2021. And tailored plans will launch December 1st, 2022. Some of the beneficiaries will remain in NC Medicaid Direct and will transition to NC Medicaid Managed Care at a future date. And there's your timeline right there. Now let's talk about standard plans. Most Medicaid beneficiaries are in a standard plan. Standard plans provide integrated physical health, basic behavioral health, care management, pharmacy, long-term services and supports, and other services to address other unmet health-related needs. They also provide services such as wellness programs. The added services differ among the standard plans. Maybe you do not know what standard plan you're enrolled in. You have questions about your standard plan or want to change your standard plan. Who do you contact? You contact the enrollment broker. That's who I'm with. And our number is 833-870-5500. And the standard plans that are available statewide are Mara Healthcare TOS, Healthy Blue, United Healthcare, and WellCare. And Carolina Complete Health is only available in regions 3, 4, and 5, which would be your orange, green, and blue. They're on, excuse me, not, yes, okay, get my number straight. Region 4, 5, and 6. I apologize, regions 3, 4, and 5. Okay, the EBCI tribal option is a health plan managed by the Cherokee Indian Hospital Authority, CHIA, to meet the needs of federally recognized tribal members and others eligible for services through the Indian Health Service, IHS. The EBCI tribal option launched July 1st, 2021. The EBCI tribal option addresses the unique health and medical needs of federally recognized tribal members, IHS eligible beneficiaries, and their families. Tribal members are able to select a primary care provider that is part of the EBCI tribal option network. The EBCI travel options primarily offered in 5 counties. That's Cherokee, Graham, Haywood, Jackson, and Swain. Members in the following counties may opt in: Buncombe, Clay, Henderson, Macon, Madison, and Transylvania. The EBCI travel option offers for added services for beneficiaries who enroll. Now, NC Medicaid Direct. NC Medicaid Direct is North Carolina's healthcare program for beneficiaries not enrolled in standard plans, tailored plans, or EBCI travel option. NC Medicaid Direct provides care management for physical health services through Community Care of North Carolina, CCNC, and there are 6 local management entity managed care organizations that we call LME, MCOs, across the state of North Carolina that coordinate services for mental health disorder, substance use disorder, intellectual developmental disability, IDD, or traumatic brain injury, TBI. The 6 LME MCOs across the state are Alliance Health, East Point, Partners Health Management, Sandhills Center, Trillium Health Services, and Via Health. Now, what's happening now? Let's talk about that. Taylor plans, they're going to launch December 1st, 2022. Taylor plans are integrated health services that provide physical health, pharmacy, and enhanced behavioral health services, just like the other health plans. It also provides additional services such as wellness programs. The added services differ between the Taylor plans. Taylor plans will provide non-emergency medical transportation, NEMT, for Medicaid covered services. This also includes carved-out services such as dental and vision services. Now, Taylor Care Management, TCM, is a big piece of the Taylor plan. TCM helps coordinate all the services provided, such as physical health, behavioral health, long-term services, and support food, housing, and transportation resources. Now, Provider Network, let's talk about that. Provider Network is a group of doctors, hospitals, and other healthcare providers who contract with a healthcare option to provide physical and behavioral health care. Taylor plans will have a network of providers for regular visits and specialists that a member needs certain services from, like physical therapy. Anyone can use the Medicaid and NC Health Choice Provider and Health Plan Lookup tool to assist locating providers. It's located on our website, ncmedicaidplans.gov, and I'll show that to you in a moment. Now, again, there are 6 Taylor plans across the state of North Carolina, but only 1 Taylor plan serves each county. The Taylor plan assigned is for the county that manages the member's Medicaid case. And there are 6 Taylor plans in North Carolina, and they are Alliance Health, East Point, Partners Health Management, Sandhills Center, Trillium Health Resources, and Via Health. Now let's look at the timeline. On August 15th, 2022, auto enrollment into the Taylor plan begins. Those auto-enrolled will begin receiving mail informing them of their enrollment and their healthcare options available to them. The Taylor plan member can choose a primary care provider and a Taylor care management provider. The beginning of the choice period is August 15th, 2022, and they have until October 14th, 2022 to make their choice. Members can make this choice by contacting their Taylor plan. If they do not choose a PCP or TCM, one will be chosen for them beginning October 15th, 2022. For those that use NEMT services, they can begin contracting their Taylor plan on October 17th, 2022 to schedule transportation for appointments on or after December 1st, 2022. Okay, moving to some more information. Now, as a recap of the timeline, we're going to discuss each important date in a little more detail. Now, what is auto enrollment? Auto enrollment will occur August 15th for those beneficiaries identified to enroll in a Taylor plan. After auto enrollment, members will receive a letter in the mail with their enrollment and choices. Those that are part of a special population, such as federally recognized tribal member, IHS eligible, dual eligible, or other special populations that are excluded from NC Medicaid managed care for any reason, will not be auto-enrolled in a Taylor plan. Now, those members identified to enroll in a Taylor plan can contact their Taylor plan to choose a primary care provider and Taylor care management provider between August 15th and October 14th. Some members may have other healthcare options, and this information will be provided in the letter they receive. Now, if Taylor Plan members have not chosen a primary care provider or a Taylor Care Management provider during the choice period beginning October 15th, the Taylor Plan will choose one for them. If the member is not happy with the primary care provider or Taylor Care Management provider assigned to them, they can contact their Taylor Plan. The Taylor Plan will begin sending out welcome packets and ID cards to the members beginning October 15th, 2022. The PCP auto assignment algorithm used to assist with PCP assignments uses historical PCP relationships. Now, does a member need non-emergency medical transportation services for an appointment they have on December 1st, 2022? They can contact their Taylor Plan for transportation to appointments that they have scheduled on or after December 1st, 2022. Now, the Taylor Plan will begin managing the member's health care beginning December 1st, 2022. They now have a PCP and a Taylor Care Management provider in the Taylor Plan's network. So you can see here what's staying the same and what is changing. Now, we want to be sure that you know more about working with the North Carolina Medicaid enrollment broker. To ensure that you're fully aware of the functions of the enrollment broker, the next section will walk you through more in-depth information about the role and how beneficiaries members will use the channels available to them. The enrollment broker receives information needed to mail out the enrollment packets to beneficiaries and members. The enrollment broker provides choice counseling to beneficiaries and members to educate them about NC Medicaid managed care and their healthcare options. The enrollment broker will assist any health plan change requests from members enrolled in a health plan. The enrollment broker also has an outreach team that provides outreach to the community. As the enrollment broker, we provide many services in North Carolina. The services provided by the enrollment broker include providing a communication hub for Medicaid beneficiaries, members, providers, and health plans. We distribute notices. We process enrollment broker return mail and provide the data to the state for distribution to local DSS offices to assist with identifying members with invalid addresses. We conduct outreach and education across the state of North Carolina. We have a team of approximately 45 outreach specialists throughout the state that provide outreach and education through a variety of avenues, such as in-person and virtual events. We partner with and support the local DSS offices and community-based organizations. We provide member materials that are understandable and accessible. We provide fact sheets, palm cards, and an easy-to-understand video. We maintain the website, the mobile app, including the Medicaid and NC Health Choice Provider and Health Plan Lookup Tool. We also provide choice counseling and enrollment assistance to beneficiaries. We have a call center that continues to be the core for choice counseling. We also assist beneficiaries with navigating through the different channels provided. Now, the goal of the enrollment broker is to meet the member where they are. The enrollment broker offers a multi-channel solution for North Carolinians. New self-service options and user-friendly avenues for obtaining program information and receiving assistance are all designed with the member in mind. The enrollment broker can provide choice counseling and health plan change support through a variety of different channels, such as website, at the website ncmedicaidplans.gov, where they can also chat with an enrollment specialist. They can use the mobile app or contact the enrollment broker at the call center. Now, ncmedicaidplans.gov website is designed to enhance online access to program services and provide a seamless enrollment experience. The NC Medicaid Managed Care website is compatible with Microsoft Edge, Firefox, Chrome, and Safari. The website also includes features to adjust font preferences. The enrollment broker supports paperless communication with members. If they're not enrolled in paperless, the enrollment specialist at the call center will educate them about the option and offer to enroll them. More information on these options is available on the website. Now, there are two parts to the website. There's your public-facing website with general information that includes questions and answers, healthcare option guide and lists of benefits, Medicaid and NC Health Choice Provider and Health Plan Lookup Tool, program information, brochures, and enrollment forms as downloaded PDFs, and a list of outreach events in their county. And now the secure web portal is for the members who have specific information. Now, here's an example of the Medicaid and North Carolina Health Choice and Provider Lookup Tool. To assist the member in selecting a health plan, the member can select and view up to 3 health plans side by side. This also allows the member to view details such as copays, information on what services a health plan covers, and the health plan's website, telephone number if the member has more detailed coverage questions. Now, members can access a PDF version of the guide in the enrollment materials section of the website. Now, the web chat feature at ncmedicaidplans.gov website provides a real-time assistance channel for users visiting the website. Every page has a chat with us button at the bottom right that the users can click to begin a chat conversation with enrollment specialists through the secure web portal. The enrollment specialist staffing the web chat will respond to incoming chats within 20 seconds. The beneficiaries will receive a pre-chat survey asking for basic information, including their name and topic of interest. So there are many topics, including general website information, general Medicaid information, provider questions, view health plans, enroll, disenroll, or change a health plan, check enrollment status, request information for the health plan, and update contact information, update authorized rep, form requests, and lost stolen Medicaid card replacement. Enrollment specialists will provide chat assistance. Who do that must demonstrate strong writing abilities, including proper grammar and accuracy in spelling. Enrollment specialists will be cross-trained in phone-based and web chat assistance so they can seamlessly and quickly switch from phone to chat if necessary. Enrollment specialists will document all beneficiary interactions, including web chats, in their system for complete tracking and reporting across all channels of communication. There's also an online satisfaction survey directly following each chat session. Now, the app, we have an app. It can be used in English or Spanish as set by the user preference, and beneficiaries can use the app to choose a PCP health plan and enroll. This graphic highlights key features of NC Medicaid Managed Care mobile app. Like the website, users can use the app to view health plans, search for PCPs, complete enrollment, and make changes to their health plan and provider choices. The NC Medicaid Managed Care mobile app will perform a real-time lookup with NC Fast to pull the most current information, beneficiary data across their case information and make sure it's displayed on the screen. After authenticating as head of household, the user will be able to view enrollment information about each member tied to the case. But after authenticating as non-head of household, the user will be able to view enrollment information about their case only. Now, enrollment specialists, how can they be reached? They can be reached by phone by calling the toll-free number 833-870-5500. For the hearing impaired, beneficiaries can use the TTY number at 711 or relaync.com. Enrollment specialists at the call center are available at the call center for support Monday through Saturday, 7 a.m. to 5 p.m. and for extended hours, 7 a.m. to 7 p.m. Monday through Friday and 7 a.m. to 5 p.m. Saturday during the Taylor Plan Choice period that is August 15th through October 14th. Now, the enrollment broker has an outreach team dedicated to community and member engagement, as well as tribal community outreach. These events can be either virtual or in person. And the enrollment broker also provides materials that are easy to understand and easily accessible. Now, the materials shown here are intended to help inform beneficiaries and members about NC Medicaid Managed Care. Materials provide appropriate contact information for the enrollment broker to help beneficiaries and members learn more. And these first two are both 8.5 by 11. The other two at the inner palm cards are business card size. And then the enrollment broker team will share information about beneficiary members at a local level, the variety of community events listed by county, and these will be listed on the website and updated regularly. On ncmedicaidplans.gov homepage, scroll down to the left and you'll see the meetings and events. From here, users can click Find a Meeting Near You. It shows you there. There we go. And for the meetings and event page, users can select their county from a drop-down menu and click Go to view results. And this will be constantly updated about every 2 weeks of events coming up that we're going to be participating in, either virtually or in person. Now, there's a lot of information that's been covered today. Now, what are key items for you to know and take with you today? We're going to review those now. Now, if you're a partner, you can help ensure members know where to go for different questions. DSS will still be responsible for handling all questions related to Medicaid eligibility. And for all questions related to choice counseling or changing health plans, members should reach out to the enrollment broker. The enrollment broker can also provide support for the mobile app and the website. And for beneficiaries who stay in NC Medicaid Direct, questions about their benefits and claims should be directed to the NC Medicaid Contact Center. And after health plan enrollment, members should contact their health plan for benefits, replacement cards, and change in PCP. BBCI tribal option members should contact DSS for replacement cards and change in PCP. Give you a moment there to look at that information. I really appreciate you all being here. For any questions, I believe I want to direct people to the Q&A section as well.
All right, thanks, Carter, for that great presentation and all of the information. So I can see we do have some questions that have come into the Q&A. So Beth Brooks is going to moderate those questions for us, and we will do our best to answer. And if we are unable to answer, we will definitely be doing some research for you and getting back to you with the answers. So Beth, I'll let you take it from there.
Okay, the first question is, can I please have a copy of these slides?
We actually have those on our website, and I'll put that link in the chat. Just one moment. Go ahead and get that for you.
Okay, next question is, can a member have PCP provided? Okay, let me read that question again. Can a member have PCP provide tailored care management services if the PCP is an AMH plus agency?
You want to throw that over to Rachel? Do you want to give a shot at that one?
Sorry for the delay. I had to double unmute myself. Sorry. So the question is, can a member have a primary care physician provide tailored care management services if the primary care physician is in an AMH plus, Advanced Medical Home Plus agency? So the answer is dependent on your status. So if you are a Medicaid member and you are interested in receiving tailored care management from an AMH plus, the answer could be yes, because all Medicaid members have the option of receiving their tailored care management through either a tailored plan like Partners or the care management agencies. Sorry, I'm getting all of my acronyms all mixed up in my head, or a advanced medical home. So they have choice of 3 places they can get their tailored care management.
Thank you, Rachel. For what time period can a client determine they are dissatisfied with a TP provider and decide to change? Is this continuously open?
They need to contact the enrollment broker, and we can review their concerns and be able to address it, help them address it. So, ongoing.
Thank you, Carter.
Mhm.
Next question, are the tailored plans responsible for tailored care management? Will each plan provide that service?
Can you repeat that,
So
please? Go ahead.
Go ahead.
Go ahead,
Oh, I
Rachel.
was just going to say that tailored plans like Partners, Alliance, Via, etc., all have contracts to provide tailored plan care management, and they are called tailored plans. So yes, they are responsible for providing tailored care management when chosen to do so. Again, there is choice out there.
Okay, thank you for that, Rachel. Next question, will the prepaid health plans be a part of the funders for beneficiaries covered under tailored plans in North Carolina. Do we need to ask for clarification on that question?
I think so. That one's worded kind of oddly.
Okay, so if you don't mind, for the person who asked that question, could you maybe clarify that question so we can answer that appropriately? And while you're doing that, I'm just going to move to the next question. And that is, many tailored plan participants rely on family members and or guardians to assess their needed services. Personally, that means attending annual ISP meetings, sysavals, and routine weekly, daily scheduling of authorized supports. Are we measuring, recording, and or aware of the burden placed on these natural supports and how to minimize their overuse?
I think that might be one that we want to take back. I am not aware of measuring and recording the responsibilities and activities of the family members, guardians, etc. But we can take that back.
Okay. Next question. As a provider, I still remain unclear about the difference between all three: standard plan, Medicaid direct, and tailored. Is there any tool that provides clarity on the differences?
Well, DSS determines eligibility. I can take that back and see if there is some sort of information that might be helpful for that, if that's okay.
Okay.
Do we want to try to define each one of those as simply as possible?
Let's see. Go back up. I'm looking. Depends on the person's care needs. I'll look. If we can come back to me in a moment, that would be great.
Sure.
I feel like I can maybe try to make a really simple answer to
Oh,
that.
that'd be great.
Okay, so think about how Medicaid operates now. The managed care organizations manage behavioral health, and we are the ones that authorize those services and have a provider of networks for behavioral health care. And then all of the other, your physical health, you're going to the doctor, you're going to the hospital, and that's called fee for service, where you're paying as for each service as you go. Whereas on the behavioral health side, when it's a prepaid health plan, the state of North Carolina Medicaid dollars and other dollars are given to each of the managed care organizations to manage those services. So that's how it's happening right now. That's Medicaid Direct. So anyone that's staying in Medicaid Direct, that is Medicaid Direct. The standard plan, which went live in July 2021, the majority of the people who are served by Medicaid have moved over to the standard plan. Those are folks, and in the standard plan, they're being served with both behavioral health and medical health, the whole person care. Typical person, not super complex, may have some behavioral health needs that are more, I don't want to say minor, but not super complex, and physical health needs. Those that are going to be moving to the tailored plan I have more complex needs and need more enhanced services. So standard plan doesn't need as much as enhanced services. Tailored plan needs more enhanced services. Both are serving the whole person, Medicaid, or excuse me, medical and physical health. And Medicaid Direct is how our system is operating now. And I hope that's helpful. I hope that didn't confuse you even more.
Thank you, Anne. Okay, next question. Or, yes, most grateful for your presentation. May we have a copy of these slides? And I think, Carter, you said it is on your website.
It's on the website. I've also added to the chat.
Okay,
That's actually got the slides that were shown today.
very good. As a provider, is there materials that we can post for our clients?
Yes. If I can share the website and show people where that is that okay?
Absolutely.
Okay, just a moment. I'll get the website up. So I give y'all kind of a little preview of that to show you where the materials are. Okay, I'm going to share my screen again. Oops. Let me close that out. Okay, do y'all see the website, ncmedicaidplans.gov?
Yes,
We do.
ma'am.
Great. Okay, under member resources. Over here at the top, you see member resources. You're going to scroll, you can change English to Spanish, click of a button here, English, Spanish. And then the bottom, this is where you can pull up the fact sheet that we have. If you go on the Spanish site, you'll be able to see the same information in Spanish on this document. This is a front and back 8.5 by 11. So it gives some basic information on standard plans and on tailored plans. And then it has questions if you want to speak to individual. Yes. Okay. So it'd be great if you're able to print that off or post that or share that online, that type of information. And then there's also, we have a smaller item called a palm card. That's like a business card size that you can also print off as well. And let me see if I can navigate back onto where I need to be. So that is that. And there's one more piece I wanted to show you while I got away too fast. Sorry about that. If you go to the front of our page, always go to the logo. If you get lost, go to the top left logo, it takes you back to home. But the bottom of the page here, it shows where we have outreach events, and you would select your county and see what's going on within your county. So you just do the drop down, select it.
Carter,
Yeah.
we can't see your
Oh,
screen.
I'm sorry. Oh, how sad.
That's okay. That's okay.
Sad. All right. I changed screens too quickly. Okay. So do you see join a community meeting, find meetings, events near you?
Sure do.
All right. And you would select here, you pick the county that you're interested in looking for an event for, and I'll pick up Buncombe. The website's going to be updated here. It usually updates about every 2 weeks. So these events have occurred, but this will be the same thing to look at. If we have a virtual event, you're going to have login information, links, and if it's in person, you'd have something physical, an address to go to. Thank you.
Perfect. Thank you. Next question. For providers who provide enhanced services such as substance abuse and trauma, how does the person transfer from standard plan to tailored plan?
They would need to talk to the DSS office regarding their eligibility potentially changing and see. That's my suggestion.
Okay.
This, if you're switching from the standard plan to the tailored plan, you can reach out to your provider. You can also reach out to your MCO, your tailored plan, to get some support in that transition of care.
Just to clarify, has this person been notified they're going to be going to tailored plan? Or do they want to go to tailored plan?
They won't just switch from standard plan to tailored plan.
I believe that would involve DSS regarding, make sure they meet the eligibility for that. Maybe other folks have additional information to provide.
When will members know who the AMH pluses are? Rachel, do you have any insight on that?
So when they receive their choice letters in the mail, they'll be given the options and available agencies or entities that they can choose from. So that is one method of notification of who the tailored plan partners or care management agencies are and who they're certified through the state. So there's a select number for our area, and it will also include AMH Plus information if it is available at the time of the choice letter. Other avenues of finding out who has been or gone through and successfully completed their certifications is going to the tailored plan website under DHHS or North Carolina Medicaid and finding those under the tailored care management plan pages.
Okay, thank you. Next question. So how will individuals be selected as to whether they are on the standard plan or tailored plan?
Oh, you-
I
do you have
can-
to- oh, go ahead.
No, I can give it a shot. So standard plan, people will come in and out of the standard plan and tailored plan unless you are a member that has long-term support service needs. So it depends on your need at the time. If you're currently not receiving any behavioral health type programs or services or have those needs, you are a member with Medicaid and you're typically enrolled in the standard plan. If those needs change over the course of time and you need to enter a behavioral health type situation, then you would, there will be outreach from the tailored plans as well as you can reach out to the tailored plans for assistance through our access lines.
Thank you, Rachel. Will someone who has dual coverage, Medicare and Medicaid, can they get reimbursed for behavioral health services that the primary coverage does not reimburse?
I'm processing. I might have to think about that one for just another minute before I can answer that question or attempt to answer it.
Okay, and if we don't come up with an answer, we can take that one down and make sure to answer it, get that. Are there any PHPs that are tailored plans?
I'm going to go out on a limb and ask if it does PHP, are you talking about a primary health provider, which is a primary care physician, PCP, or are you talking about a PIP, a prepaid health insurance program? But let me try to answer. Are there any primary care physicians that are currently tailored plans? No, they would not be considered tailored plans. They would be considered advanced medical home plus and provide tailored care management as part of their service rate. But so I think we're a little bit mixed up on the language and I'm not doing it justice. So if we can get clarification from that person that's asked the question, that would be great.
Okay,
If that person who asked the question would like to raise their hand, we can unmute and so that you can clarify.
and then moving on, what about the different types of Medicaid that DSS approves? Do we need clarification on that question? Okay, So if you can clarify what you're asking, or you can raise your hand and we can unmute you. And then the next question is, how does this affect our dual patients, ones that have Medicare and Medicaid?
They're not a part of the open auto enrollment right now for Taylor plan. Can add that.
Unless they have innovations. Innovations is a specific program.
So, and otherwise they would stay a part of Medicaid Direct. When you're dually eligible for Medicaid and Medicare, and you would be served by Medicaid Direct, being North Carolina Medicaid for physical health, and the MCO for behavioral health.
Thank you all. What is the plan to recruit doctors, especially specialists, to participate? Families are seeing PCPs and specialists pull out in anticipation of this change.
So our provider network is currently working on that. And last I heard, we had approximately 60% added into our plan. So it is in process that we are recruiting primary care providers and specialists to be part of the health plan.
What about dental?
Dental is what they call a Medicaid carve out, which means that full Medicaid does in fact cover dental. So if you have dental covered by Medicaid right now, that shouldn't make any change.
So will each person have a DSS worker assigned? And will we be given a name?
So I don't believe anything changes as far as Medicaid workers at DSS. Right now, if you have Medicaid, you would call your local Medicaid office or your home Medicaid office and ask about if you're trying to reach a Medicaid worker about specifics, then that would be routed to the appropriate staff that's assigned for you.
Thank you, Rachel. Next question, how are members being notified about the website and basic information? Has anything gone out by mail?
Notices start going out the 15th that will include our contact information along with what they're eligible for.
Next question, is DSS prepared for the influx of calls? Communicating with Medicaid determination currently is a challenge.
I don't know.
That is definitely a DSS question. And yeah, it's definitely a question for the Department of Social Services.
Who determines medical necessity for a need to switch from Medicaid Direct or DSS?
Great question.
Or no, sorry, the MD or DSS.
Okay, provider.
Determines medical necessity for a need to switch from.
Need to
DSS.
switch plans.
DSS question. Oh yeah, true. Switch plans or switch Medicaid Direct, standard plans, Taylor plan. Okay.
Okay, so the way I understand it, and Carter, you can help me here, or Rachel, if the provider that you're working with identifies that the individual is in need of an enhanced service that the standard plan doesn't offer, then that would promote a switch from the standard plan to the tailored plan.
Change of request. Let me see if I can find where that form is on the website. We're the clearinghouse for that form. We don't actually process these. But let me see where that is on the website.
So So as a managed care organization and MCO right now, we are processing transitions of care from the standard plan right now
Mhm.
to back to the MCO because the need for an enhanced
Right.
service.
There is a place on our website, a form to fill out. I'm going to put the web address in the chat. Again, we are the clearinghouse. People send those through. We put this to everyone.
Melissa, did you want to add to that?
Yeah, it's
I forget
called a
that
request.
you are resident expert here now.
I wouldn't call myself an expert, but it's called a request to move
Mhm.
form. Usually the providers submit those and we usually get them from you at the enrollment broker. Then we do a warm handoff staffing to determine. But if you're currently enrolled in a standard plan and you need to access like behavioral health, IDD, or substance use disorder services, you can submit that request to move, or the provider can submit it. Just wanted to make sure that you guys knew that.
And you should see on your screen, this is where you do submit forms, and they'll take you here. And this is where you can go ahead and complete that form. Depending on the provider would fill this out, beneficiary fill that out. And I put the link for this in the chat.
Thank you, Melissa and Carter, for that. Next question. So a person that comes in that has experienced sexual abuse, example, will DSS then change them to a tailored plan? Are they qualified to do this as it usually requires a diagnosis? Would we say that's a DSS question?
I would say so. I guess I would agree that it's a DSS question, but I would also agree that they probably need to have a diagnosis. So, but I am not an expert in this area, so we would have to take that back.
Okay. Are those without Medicaid, IPRS taken care of?
So I can speak to members that are without Medicaid and have an IDD need. So tailored care management is offered to individuals without Medicaid coverage on a short-term intensive basis after meeting some triggers, so that it's typically the care manager, and this is provided by partners, not by, there is no choice of a care management agency or a advanced medical home with this situation. You would receive tailored care management from partners for a very short, intensive period of time to basically meet those initial needs. It usually lasts no more than 90 days.
Thank you, Rachel. Next question. So basically everything will run through DSS. This is scary as they are always behind and do not respond timely. Who can we advocate to?
So the responsibilities of DSS will remain the same. They determine eligibility for Medicaid. When it comes to treatment, that is absolutely up to our providers, our licensed clinicians, our physical health care providers, et cetera. So again, DSS remains in charge of eligibility for Medicaid coverage.
And I'd like to add to that, just, it's not my area of expertise, but the question was specific to a member presenting at an office with need for potential therapy because of a incident that occurred. So providers will have access to do their assessments and make referrals to the MCO, or not referrals, but some type of communication to the MCOs about a need for a member. And your processes shouldn't change that much. And members can always contact partners access line for crises like that and be referred out appropriately. And that would start the assessment process and planning process to either assign a care manager to do a care management comprehensive assessment and link them to other needed sources, et cetera. So I don't want the idea that something is going to be a barrier or challenge when a member is presented in your office with a need.
Thank you, Rachel. So the next one is a clarification for, are there any PHPs that are tailored plans? So let me go back to,
So prepaid health plans, which currently LME are PIPs, as they're called, and each one of the 6 that we talked about earlier, Partners Via, Alliance, Sandhills, and missing one. my mental list stops for some reason. But anyway, we are all tailored plans as long as they pass the readiness reviews.
what insurance would someone have for dual diagnosis, Medicaid, etc.? How can homeless person apply for Medicaid first time? What is the process?
So I don't think any of that changes. If a person is applying for Medicaid for the very first time, they would go to a local DSS and apply for Medicaid there. Would someone have a dual diagnosis, Medicaid, et cetera? Again, if you're applying for Medicaid, DSS is the place to apply for.
Next question. So all the LME MCOs will be managing tailored plans, and there will also be private agencies who are also managing tailored plans. Is that correct? These private agencies who manage tailored plans, also called the Advanced Medical Home Plus. Is that correct?
I'm going to try to sift through that. So tailored plans, like Partners, offer tailored care management and manage all of the behavioral health needs, in addition to supporting and addressing any physical health needs, right? So all LMEs will be managing tailored plans. All LME MCOs will be called a tailored plan, right? And they offer tailored care management, which addresses needs. There will also be private agencies, yes. So one of the standard items in managed care is to have community-based programs out there to support, such as tailored care management. So yes, there are community-based private agencies or not-for-profit or whatever, some other entities out there that will provide and offer tailored care management as well. They aren't managing the Medicaid dollars, they're offering a service. Okay. I think I answered that.
Right. So the current LME MCOs will manage the tailored plans, manage the funding. And as Rachel talked about, the tailored care management, which is part of a tailored plan, will be managed by, yes, private entities, but just the care management piece, not the tailored plan per se. So think about it as it's a health insurance. So if you're part of the tailored plan, that's your health insurance plan. So when you look at your Medicaid card, it's going to say Partners Health Management Tailored Plan, or it's going to say via tailored plan. And that will be your tailored plan. So I hope that helps clarify tailored plan versus tailored care management. The tailored care management is the care manager that helps you manage all of your services.
Thank you for that. Next question, will most PCPs associated with big hospital systems like Novant or Atrium be advanced medical homes?
I think we're going to need to take that one back. And I want to point out that it is 2:00. It's actually 2:01 right now. So we still have several questions.
Yes.
So to be respectful of everyone's time, I do think that we need to come to a stopping point. We can take the rest of the questions and come up with some answers for you and respond to those who have attended our session today. So we have all of your email addresses, and so we will gather information and answer and let you know where the answers will be located. So, but I really want to thank you for spending your time with us this afternoon, and especially want to thank our guest speaker, Carter Wade from the North Carolina enrollment broker. And thank you so much to our subject matter expert, Rachel Jerzak, for joining us today to help field the questions. I know you all have many questions, and this is a change for, it's really a change for all of us. So we are here for you, and more education to come. So thanks for joining us. Y'all have a great afternoon.